So one way we can help advance the food is medicine movement and improve overall health is to help our patients enjoy more fruits and vegetables, such as avocados. Avocados are a heart-healthy fruit, and recent research has linked avocado consumption to a better quality sleep, physical activity, and diet quality. So I'm going to share a few more details from 2 recent publications in just a moment. But before that, we just want to highlight some other nutritional attributes of avocados. So on the screen is what 1/3 of a medium avocado serving looks like. And then again, avocados are a good source of fiber. And then, yes, you can see all the different benefits. There's 250 milligrams of potassium. So this helps offset some of the sodium's harmful effects on blood pressure. And then with the predominant fat in avocado being unsaturated fat, we can substitute this in like our recipes, or we can substitute it for foods higher in saturated fat, such as butter and other full fat spreads. So it's a great replacement, a healthier replacement. And then according to the dietary guidelines for Americans, replacing saturated fats with unsaturated fats, such as avocados, can reduce the bad cholesterol, the LDL level in our blood, which can then lower our risk for heart disease and stroke. Also, avocados have 0 sugar. So this is a great addition to our patients who we are concerned about diabetes, because it should not significantly raise their blood glucose. Okay, so avocado intake linked to sleep, diet quality, and cholesterol. So this slide highlights a study supported by the Avocado Nutrition Center and recently published in March of 2025 in the Journal of American Heart Association, which investigated how eating 1 avocado a day for 6 months affects cardiovascular health. And then researchers in this study used the Life's Essential 8 framework as an assessment of cardiovascular health. So again, it's that framework that we discussed earlier in the presentation. This ancillary study was part of the habitual diet and avocado trial, looking at the impact of consuming 1 fresh avocado a day for 6 months, and its effect on weight-related measures, markers of cardiometabolic risk, and diet quality. So in this study, we had 969 US adults with elevated waist circumference. And the key findings are, so there are 8 across the 8 factors in the, in the Essential 8 framework. So the total composite score, so it did not change the total composite score when we looked across all 8 factors, but when we looked at specific factors, so the scores for diet quality, sleep health, and blood lipids, that's where we saw improvements in those specific factors. And then for blood lipids, there was a decrease in the LDL and total cholesterol. All right. So this is another study supported by the Avocado Nutrition Center. Findings from this randomized control trial involved 72 Hispanic families and showed that increasing avocado consumption was associated with higher reported levels of physical activity over 6 months. So in this study, participants were divided into 2 groups. One group either consumed 4 avocados per week, or the other group 1 to 1.5 avocados a week. And then what they found is increased avocado consumption led to a significant reduction in calories, saturated fat, sodium, as well as dairy, refined grains, and red and processed meats. And then it's important to note that neither group experienced changes in their body weight, BMI, or waist circumference, despite the added calories from the additional avocados consumed per week. So this is a great example of how healthy habits are like dominoes. You knock one down or establish one habit, and then it sets off a chain reaction of other healthy habits that then lead overall to big long-term positive changes. So heritage foods like avocados can be a pathway to healthy eating patterns. And then these findings align with several other research studies suggesting that avocados are a valuable part of our healthy lifestyle.